differentiate between osteoarthritis and rheumatoid arthritis. Main difference between the two is that osteoarthritis is the mechanical wear and tear of the joint, right? Mechanical wear and tear means there are degenerative changes in the joint. But in rheumatoid arthritis, it's actually an autoimmune disorder in which your own immune system attacks the body's joint, right? It's like the inflammation of the joint. As you can see in this picture, this is the normal joint. This is the osteoarthritic joint in which there are wear and tear, there are degeneration of articular cartilage. You see degenerative changes and the osteophyte formation, these type of changes. But in rheumatoid arthritis, as you have already studied, that is the disease in which our body's own cells attack the body's immune system attacks their own joint, in which the patient have inflammation, and the signs of inflammation are the redness, the hotness, tenderness, joints are warm, lesser range of motion, like these type of symptoms. So let's have a quick look at the difference. Osteoarthritis basically uh, affect the patients with old age, right? But rheumatoid arthritis people can have at the age of 30 or even 50, between 30 or 50. Okay, number two difference is morning stiffness. Actually, the osteoarthritis patient have morning stiffness. Both have morning stiffness, but the patient with osteoarthritis have morning stiffness less than 30 minutes. But in rheumatoid, it's more than 30 minutes, even 1 hour, right? And then in osteoarthritis, the joint is hard and bony, but in rheumatoid arthritis, the joint is soft, warm, tender, which is a sign of inflammation. Primary joints, basically osteoarthritis affects the big joints like knee and sometimes upper metacarpal joints of thumb and BIP, right? But in rheumatoid arthritis, basically affect the small joints of the body like PIP, MCP, ankle, joint, and wrist. In osteoarthritis, lab findings will be the normal CRP, the normal ESR, normal anti-CCP antibodies, and normal rheumatoid factor. This is also a very important diagnostic factor for rheumatoid, that in rheumatoid arthritis, patient will have positive rheumatoid factor, elevated ESR and CRP, C-reactive proteins are high, and positive anti-CCP antibody, right? और जो इसमें deformities होंगी osteoarthritis में या rheumatoid में different होंगी. In rheumatoid, you will see the ordinal deviation, bottom deformities, swan neck deformities, very visible deformities. But in osteoarthritis, you will see the nidus at distal joint back, proximal intercenter. These nidus are called Harbin's nidus and Botchard nidus. This is the main difference. Now, if you have a question that a patient came to you with the pain in, for example, knee joint and have elevated ESR and CRP, so what would be your diagnosis? So you must be diagnosed with rheumatoid arthritis. Okay. Although उसने किसी भी जॉइंट को अफेक्ट किया है, फॉर एग्जांपल कार्पोमेटाकार्पल जॉइंट को या नी को या किसी और हम डीआईपी जॉइंट को ले लें, लेकिन उसमें सी रिएक्टिव प्रोटीन और ईएसआर लेवल रेज है, तो वी कैन सस्पेक्ट कि रूमेटॉइड आर्थराइटिस ही होगा. तो इस वजह से एमसीक्यूज आपको आने चाहिए. Or we can, make a question like the patient has bottom deformity and all deviation of hand, ठीक है, or elevated CRP. So what would be your diagnosis? And the major joint affected is PIP. So you should say rheumatoid arthritis.